Hi everyone, and welcome back to my channel. If you're new here, welcome, and if you've just found me, I hope you find some helpful videos on my page. Today's video is going to be a Q&A. If you've seen my Instagram stories recently, I popped out a question box and a lot of questions came through. Most of them were clinical and career related, so I thought I would just make it into a YouTube video to avoid spamming everyone. But let's get into it because there's a lot of questions. I've got my cup of tea. I hope you've made yours. Let's go. First question, are you an OHT or hygienist, and where did you study? So by qualification, I am an OHT, so an oral health therapist. I did complete a Bachelor of Oral Health, but just by personal preference, I now only practice as a dental hygienist. So I think this is what confuses people, because I do have Bachelor of Oral Health on my Instagram page, but I do refer to myself as a dental hygienist pretty much 95% of the time. So I understand why that would be confusing. I just feel like because I practice more hygiene these days, not that it's disingenuous, like I don't think that's the issue, but because I don't practice therapy anymore, I don't feel like I can call myself an oral health therapist. So that's the reason why I refer to myself as a hygienist. And I studied at the University of Melbourne. So that's in Victoria in Australia, and I graduated in 2013. Next question is from Lena. She asks, would you come be our lecturer? So many of us students look up to you. Firstly, that's really nice. At the moment, I don't think education is for me. I quite like how I've built up my non-clinical work, and I like not having to be somewhere to work. I like that I can be away, like today on a long weekend, work from my laptop, whereas if you're working at a university, obviously you have to attend, and so I feel like I've got that part of my career down pat. I have found 2 private practice clinics that I love working at, and they will be my sort of 9 to 5 work. My other focus now is all the other things that I'm currently doing, and I don't think I can commit myself to needing to be somewhere for work at this point in my life. Charlene asks, which do you prefer, getting paid hourly or commission? This is a good question, and I prefer getting paid hourly, and this is because I mainly practice dental hygiene these days, so I'm not billing any high ticket items. So if I was an OHT and doing fillings day in, day out, I would 100% be on commission. So if there's anyone out there watching this, definitely negotiate yourself a commission structure, or at the very least a bonus structure, because as a hygienist I might be billing maybe $240, $280 per hour depending if I'm doing perio charts, but I'm not really charging more than that unless I'm providing perio treatment, and I do a bit of perio but not a huge amount. So for me, getting paid hourly, I'm content with that. However, if my scope of practice was different and I was working with the therapy scope, I would 100% rather be working on a commission structure. So it just depends about where you are in your career, how built up your books are. Like if I've just started as a practice, you look at the books and you can see your days are 30-40% gappy. I wouldn't be going on a commission structure. I would make sure that my books were at capacity. Otherwise you will be losing out on money, and your employer will be very happy because they're not having to pay you for the hours that you are sitting there and not seeing patients. So this is very dependent on where you are in your career and what type of treatment you provide. Next question is from Sweet Tooth, and what loupes would you recommend for BOH students? Not too pricey but also worth it. Now I feel if you've been following me for a while, you know the answer to this question, and I know dental school is expensive, but there are payment plans available for these types of products. If you can, I would 100% get ergonomic loupes. The ones that I've got by Byron Medical here in Australia, the Advocacy, they now offer payment plans with only a 30% deposit. So you've got the option to pay it over a length of time. I don't know what that 30% deposit may be, but my loupes, including the Butterfly S wireless light and 4 times magnification, came to about 5,000, in the low 5,000s. So 30% of that, I'm not good at math. I would highly recommend getting ergoloupes as soon as you could. Otherwise, if you use a brand called Smart Loupes, they have basically your entry level new grad student level loupes that you may want to start with and then upgrade to ergoloupes at some point. But I really recommend getting ergoloupes as soon as you can. They have changed my life, changed my sort of shoulder pain, back pain at work. 100% worth the investment. That's strong. I need to get that tea bag out now. Anna asks, why did you choose hygiene? Why not dental school? So for me, going through year 12, this is probably was a limiting factor for myself. I just didn't have the grades for getting straight into dentistry from high school, and the Bachelor of Oral Health really stood out to me. And I've also been asked, have you ever considered to retrain as a dentist? No, I have thought about it. I've been asked it many times over the course of my career, but the thought of going to uni for another 5 years in my head just does not appeal to me. And dentistry is not one of those things where you can half-heartedly go into. There's the GAMSAT, there's interviews, it's a lot of time and energy, and even to this day, I have zero motivation for going back to universities. Natalie asks, what do you have in your hygiene appointment set up instrument-wise? But basically, I have, if I can remember off the top of my head, double-sided mirror. They're amazing, especially for seeing those posterior molars. Highly recommend. Very, very good for ergonomics. There is I've got a plastic perio probe, which is autoclavable, an Explorer, tweezers. Okay, and for hand instruments, I've got a universal, a sickle, a 2L, 2R, 4L, 4R, 11, 12, and 13, 14. So those are the base kits that we use for every single patient. Okay, we're making good progress. KK John asks, what do you ask your office to buy you versus what do you buy for yourself? Bought for myself my ergoloupes. I buy my own scrub caps. I've bought my own safety glasses in the past. My office will always buy instruments, so any upgrades to hand instruments, new technologies like the airflow, chairs, saddle chairs, I will get my practices to buy. So unless it's something that is going to be personally mine that I can take home with me, the clinic will buy. I buy my own scrubs as well. Back in the days, I get sent them from Figs now, so I don't buy those anymore, which I'm very lucky for. I've heard of clinics where they have a really big emphasis on ergonomics, and I know someone whose boss bought them loupes, so find yourself one of those bosses. Ina asks, what questions would you ask at a dental hygiene interview? Now, I'm going to pop an episode of the Talk Dental to Me podcast here because it's a whole episode on how to nail your dental interview, tips to prepare, and 6 questions that you can ask. So instead of making this video super long, Chibu asks, hi Emma, as an OHT, are you on a salary hourly? I am on an hourly. And she asks, is commission common? I think it is becoming more common, particularly if you are a OHT who's performing a lot of restorative work. I think it would be very lucrative to be on a commission structure if you are practicing that way. I will say I feel like it's becoming more common these days as people are wanting to negotiate their pay and wanting to figure out ways that they can earn more. So I would definitely say that commissions something that is becoming more common. I do have a whole video of this on my YouTube though, about questions you should be asking if you want to go on a commission structure. So I will also link that in the video notes below. Sophie asks, do you get a dental assistant? I do, thankfully. One of the dental clinics I work at, I have a full-time DA, so they will work with me from 8 to 4, which are my hours at that clinic. They will set up the room, help with suction, change over in between patients, shut down at the end of the day, help me with taking x-rays, perio charts, suction, absolutely everything. So very, very lucky at that clinic. And the other clinic I work at, they have a hygiene coordinator. So the hygiene coordinator will go between both of the hygienists. We only have 2 hygienists on at a time, and our appointments are staggered. So the hygienist is able to help both of us through the day with exactly the same things that you would normally get help with and what I usually need help with during an appointment. So yes, I'm very lucky. I'm what I like to call myself. I saw this nurse on TikTok refer to herself as a soft nurse, and that is me. I'm a soft dental hygienist. It is just not in my vocabulary anymore to be a workhorse. I do not want to be seeing 15 patients a day. I think we're very lucky in Australia where that's not really the norm, whereas I have seen hygienists overseas, like in Europe and America, and they're working 30-40 minute appointments, and I'm just so glad that that is not the norm here, because I would struggle so bad working like that in those conditions, just being super highly stressed, highly strung, having to do everything by yourself all day, every day. You can know why burnout is so high in our profession, because that's unfortunately how some people are working. So yeah, if you can, please work with an assistant. It will add years onto your career and you will love work so much more. All right, next question. We're almost there. Kiri asks, advocacy for OHTs to do botox and fillers. What are your thoughts? I personally wouldn't go down that route myself, but I definitely do see the benefit. We are healthcare professionals who work in the mouth. We are very proficient in anatomy of the head and neck. So I definitely think we as a profession are capable. Whether or not I think it'll happen. I did do a podcast episode on this a while ago with someone who did do courses in Australia for dentists, but there is a lot of legislation to work through if that were to ever happen in Australia. So it would take a lot to change this, because a lot needs to happen at higher levels. As OHTs, we can't administer the schedule, I think it's schedule 4. Oh, yeah, because Botox is essentially a toxin. We're not allowed to administer anything like that. So there's lots of different changes that need to happen before that could ever happen. So lots of advocacy does need to be made. And yeah, maybe someone watching this does want to do it, and maybe they will lead on their passion. Siv asks, how long did it take for you to get used to your ergoloupes? So I transitioned in very slowly. I, for the first day, used them every other patient just for the morning, because they made me quite dizzy, and if I used it for every single patient for the first day, I would have a headache and feel nauseous at the end of the day. Second day, I used it every other patient again for the morning. Third day, every other patient for the whole day. The fourth day, I trialed using it for every single patient, and from then on, it's been completely fine. So I think the key is to really transition in slowly. Just give your eyes and brain the time to adjust. But after that sort of 1 week of using it, I cannot work without them. I am very well and truly adjusted. Teresa asks, what non-clinical careers an OHT get into? And I love this question because the opportunities are endless. So I've just got some listed here. You can work corporately, you could be sales rep, you could be a product researcher, you can be an educator, so you could go into dental clinics and educate clinicians on products. You can be at trade shows, which is what I do. You can work in public health. I know quite a few OHTs who have gone on to do a Masters of Public Health. You could be a public health officer, you can be part of local health departments. You could be a community clinic advisor. You also go and do your masters. You could become a researcher. You work at university, colleges, or corporations, for non-profit organizations. And then one of the more common ones, you can work as an educator. So this could be at a university, this could be with a company, you could be a clinical instructor, you could be a lecturer, demonstrator. If you're really passionate, you can work your way up and become clinical director, program director. Or there are so many other OHTs who have very successful businesses, who've created products, who have gone off and created their own independent mobile business, have their own independent hygiene studio. We don't need to have a dentist on site now to practice, which is amazing. So I've definitely seen a lot more OHTs who have gone out and started their own practices, which is insane. That is amazing that they have gone and done that. You can be a professional speaker, you could be a writer. The opportunities are endless. Okay, I've got two more questions. I've got two more questions. Hannah asks, would love to work a soft dental hygiene role too. Any tips on how to find a good fit? This is a great question because this is my absolute specialty. I think it's more at first figuring out what you would be content with, how you would like to work as a clinician. For me, I just don't like being a workhorse, so you will not catch me in a practice where I'm expected to see 50 million patients a day, work 30-minute hygiene appointments, where it's super fast paced. Just not a vibe for me. I know that if I want to work in a place where I am practicing soft dental hygiene and I want longer appointments and I want to work with a dental assistant, I might not be earning as much as someone else who works in a clinic where they are seeing lots of patients per day or they are seeing more restorative. I obviously don't practice therapy anymore, as I said earlier in my videos. Questions I would be asking a clinic if you're wanting to look for a role like that is whether you work with a hygiene assistant. All the job ads you see, most of the job ads you'll see that advertise quite a high commission or hourly rate is because you don't have a dental hygienist. So that's number one. I would ask how long your appointments are, what's expected of you if you have cancellations, are you expected to clock off? Like, I will not accept a job if they were to say, hey, you need to clock off if you don't have a patient. So I'm very, very picky now, but I've worked at many different practices and experienced a lot of different practice managers, management styles, the different ways clinics work. Finding a soft dental hygiene role, one of the biggest things is working with a dental assistant. That makes your life so much easier, so much less stressful. Finding a good team is important also, which is really hard because I always take first impressions with a grain of salt now. Like, you really don't know what a practice is going to be like until you spend months in there. It's like being in a relationship. You don't know what the person's like until later on. Number one is finding a really good, healthy team and bosses, and working with a dental assistant would be my top tips. Ask a question. Jessa asks, if not too personal, pay. So this question is quite broad because I work a few different jobs and I also work non-clinically as well. So if you were to ask my gross salary, it would be much more than what a typical OHT earns because I do extra work on top of just seeing patients. But I'll give you a ballpark. I'm between $60 to $68 an hour. And this might be low for some, this might be high for some. But for me, I work in 2 corporate clinics and I know that I could get more money if I went elsewhere and it was expected to do super high volumes of patients per day and want to work with a dental assistant. Like, I've come to realize that you can't have it all, and I'm very, very content at where I am working clinically and at the sort of pay range that I am at. So yeah, pay is very subjective to people, so just need to find out what suits you and your lifestyle. how you want to work, and what you're willing to compromise. So that's it, guys. That's all my questions. A lot of questions, a lot of good questions. If you need any clarification on anything that I've mentioned in this video, don't hesitate to leave a comment below, but I will see you next time. Bye.